Hey everyone. Patients always talk about advanced maternal age, and it's something that's always on their mind when they're planning for fertility treatments. They're worried about low egg quality, low egg reserve. But I find that there's this myth that there's no such thing as advanced paternal age and its impact on fertility. And so I want to talk to you about the importance, how aging actually declines fertility for sperm health, and how we can make changes and different interventions that may help to reduce damage to sperm and support fertility and health outcomes. So, first of all, it's very important to mention sperm health does decline with age. Yes, patients are always producing sperm cells as long as there's no organic, health condition that shuts off sperm production, such as hormone disorders. But in the presence of advanced paternal age, something that's a growing occurrence, in between, I think, just the last 30, 40 years, the number of couples that have a partner where the male partner is above the age of 40 is almost double compared to where it was before in the past. So this is something that's becoming more and more common for a variety of reasons, obviously. Career development, choosing to settle down at a later age, um, and the list goes on. But to focus on the role of trying to conceive after the age of 40, there's a decline in the sperm quality through a different variety of mechanisms. Three of the main mechanisms, which I think are important for us to be aware about, is number one, oxidative stress. So our body is very good at reducing the harmful impact of oxidative stress in the body through something called antioxidants. However, our antioxidant capacity, our total capacity and ability to fight off and reduce oxidative stress, is actually significantly reduced as we age. So after the age of 40, we can start to see a decline in the total antioxidant capacity, and that makes the sperm cells more vulnerable to oxidative stress. And oxidative stress has been shown to impact sperm motility, sperm morphology, and also increases something very important called sperm DNA fragmentation rates. And this is something, if you've been to see us before at the clinic, something I talk about all the time, because elevated sperm DNA fragmentation rates, something new that we're learning about in the last just 3 years, have been implicated in reduced fertility, something that's usually present in a lot of couples with unexplained infertility. And it also increases the risk of miscarriage. So it's very important to address oxidative stress through the use of specific micronutrients and antioxidants to reduce its negative harm on sperm health and therefore fertility. And there's been reviews published showing that when the male partner uses a lot of these micronutrients and antioxidants, their chances of succeeding with IVF might be double to triple compared to patients that don't. So in the presence of poor sperm health parameters, there's lots of early research and studies showing how these micronutrients and antioxidants can actually help these patients get ahead and improve their chances of success with IVF and may potentially reduce the risk of miscarriage as well. Another mechanism which affects sperm health negatively with age comes from the immune system. And so, with advanced paternal age, we see a decline in the immune system function as well. So, patients with advanced paternal age may be more vulnerable to certain infections. And if you've been following our research blog posts for the last few weeks, I've been talking a lot about the role of different bacteria, microbiomes, and how they impact fertility. And we've talked a lot about the microbiome in the ejaculatory duct and the reproductive tract and how that can negatively impact or positively impact sperm health depending on the type of bacteria that's dominant. And the presence of low-grade infections, like we've seen this with patients, can often go undetected. They're just mild to moderate symptoms, like like a bit of pain here, and may be an issue that persists for years. And as soon as we treat the infection, all of a sudden the numbers, the sperm concentration starts to go up, the sperm motility starts to go up. So sometimes these low-grade infections are present and may go undetected. And with age, we might be more vulnerable to these infections because the immune system is not as apt to fight off those harmful bacteria. The third mechanism that's discussed in a recent research paper published in 2020 looked at how declining repair of the DNA sequences in actual immune cells may actually trigger autoimmunity or autoimmune conditions. And we have something called the blood-brain barrier, which protects the brain from harmful substances that might come into the blood. We have something called the blood-testes barrier. It's the same concept, but it protects the sperm cells from being attacked by the body's own immune cells. And so, therefore, we we've seen that in certain animal models with advanced age, this blood-testes barrier becomes compromised. And so there may actually be an increased risk of immune cells targeting and damaging sperm cells as well. So it's really important to have this conversation because I find when couples are going through fertility treatments, um, 80 to 90% of the focus is on the female partner, and it can be quite unfair, especially because a lot of these factors they're modifiable. Like we can have an impact to improve the male fertility, the sperm function, the sperm health, and it's been shown to reduce the likelihood of miscarriage potentially. And it's also, this to me was mind blowing. This new paper also evaluated how advanced paternal age and all these negative mechanisms we're talking about, how they reduce sperm health and reduce sperm DNA integrity, actually increase the risk of congenital abnormalities, so cleft lip, heart malformations. It may also increase, it's been associated with an increase in the risk of schizophrenia, autism, and other genetic malformations and disorders such as Klinefelter syndrome. So when we're looking at treating sperm health and fertility, it's not just limited to it's going to help us get pregnant. It may affect the miscarriage rate. It's also looking at we may potentially be having an impact on the long-term health of the offspring as well. So it's very important with advanced paternal age, or if there's idiopathic low sperm health or sperm infertility, to look at these underlying causes that may actually be contributing to that. And if we can change some of those underlying causes, in quite a few cases, we see that patients respond positively and the sperm parameters improve. And that's why I love doing the sperm test for these patients, because we can objectively measure, before and after, are the numbers actually going up. So it's something we've been seeing in practice as well, like these low-grade infections. Once we treat them, how the sperm parameters start to jump up all of a sudden. So if this is something, you're preparing for fertility treatment, you're thinking of trying to conceive naturally, or you're preparing for an IVF, or you've had a history of miscarriages, this is a very important aspect to discuss, and we're always happy to chat about it. So if you're curious, book an appointment or get in touch with us, message us, email us. We're always happy to answer questions.